What's up, everybody? Welcome to my webinar on understanding and recognizing the four components in the injury presentation. Those of you that don't know me, my name is Dr. 𝘵𝐻𝐻𝐿. I am the creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment method that focuses on working smarter, not harder, allowing them to make well over $100,000 per year with less than 20 hours of time per week in the clinic. I like making these webinars because I really want to help just educate you a little bit better about what's going on. We tend to live in this world where everyone is very treatment specific based, like I do a certain type of treatment and this is what I'm looking for, and really recognizing that there's more components to the injury, more things going on, and a lot of people are missing that. And I always say, if you don't know the full aspect and the concepts of what's going on, you're never going to be able to fully resolve these problems and get the clients the treatment that they need up front in a more conservative care model, instead of having to resort to bad things down the road like pain pills, injections, and surgeries, which only make things worse. I've done a lot of other webinars breaking down how to ask the right questions, what potentially could cause a problem in the tissue or the structure. All those links are in my YouTube profile, and I'll also put them in the links on this one as well. But this one, I really want to dive into a more full concept of what's going on. So let's jump right into it. So the problem with reductionist thinking in the injury evaluation, I talked about this just a minute ago. The idea is like everyone wants to diagnose or evaluate based off what they're trained in instead of what the client actually needs. So like chiropractors look for the bone's out of place, they're going to do adjustment. Physical therapists look for, oh, there must be some weakness or decreased flexibility, so they're going to stretch it or they're going to strengthen it, instead of really looking at what's fully going on with the client. And I cover those a lot in those more in-depth webinars, because you have to start thinking critically and figuring stuff out. So number one is there's multiple factors we must consider. The client doesn't live in a bubble. We tend to be really reductionist thinking as manual therapists, like it's only a tissue problem. That's the only thing that's going to be there. I did an evaluation this week on a new client that clearly had other issues going on, metabolic issues, problems with the discs and the joints. And they've been told throughout the whole process that it's strictly a muscle problem and that's it. And that's not setting that client up for success. Another question that I always want to know was there trauma or a specific mechanism to the injury? A lot of times when there's direct trauma, like a car accident or a fall or a break, a lot of times that actual structure is causing the problem. But a lot of times there was no trauma and it's just a competitive overuse, repetitive type of motion type of thing. And you got to really search for what's going on. A lot of people go to the effect of the problem instead of really getting to the cause of that. Number three is just getting to a tissue specific problem list. I always say, if you don't know what a problem is, you can't fix it in the first place. And people don't just live in this one area. And I see this a lot, especially with manual therapists that might do one certain thing. They're like, oh, well, I do lymph flow treatment, so it's got to be the lymph, or I'm a fascia person, or I'm a Reiki person, or I'm a reflexology person. It's like, no, that doesn't really tell us what's going on. The client has multiple problems and you need to identify all those problems. Another problem in the injury component that we tend to miss a lot as practitioners is there's a huge emotional component of being in pain and not being able to participate in normal activities. Pain can really mess with people and put them in a weird place and cause them to be depressed. It can make them short-sighted. It can make them angry, frustrated, sad, all those things. And lastly, you want to be able to set yourself up for success in the treatment and being able to avoid problem cases that you can't help. We tend to be these practitioners that we want to help everybody. And I always say, I heard this from a mentor a long time ago, if you are for everyone, then you are for nobody. Someone smarter than me said that. But the idea behind that is like being specific about what you fix, what you do, how you do it, and only taking on those clients that that you can help. We can't fix every single person with manual therapy. Like manual therapy is very important. And I think it needs to be the go-to to start for any injury presentation or process. But at the same time, if we're not seeing progress, a lot of times it's because we miss something as we go through. So let's jump into it some more. So there's 4 components to the injury. So I've had these other webinars where I say the 12 questions you ask, and then the 7 potential problems that you can have: bone problem, cartilage problem, disc problem, ligament problem, nerve problem, soft tissue problem, tendon problem. Those are the 7 problems you're going to see in there. But based off of that, there's also some how the client actually presents. So one of those is just going to be a tissue problem. That's going to be like your muscles, your ligaments, how your nerves function through things. Next one's going to be your structural things. That's going to be your bone, cartilage, your discs, and your tendons. Metabolic is just like, how healthy is this person? Are they not taking care of themselves? So they smoke? Do they drink? Are they overweight? Do they have stuck at a desk all day? And lastly is this psychosocial. Like, how is this mentally affecting this person, and what is causing their issues in there, and recognizing what's going on. So what I'm going to break down in this webinar is each one of these and how we kind of fit in as a practitioner. So tissue is the most common cause of decreased flexibility, weakness, and pain in the human body. Awesome, right? Also the most fixable problem in the human body, with expert evaluation and treatment, of course. So I focus really on diagnosing and treating scar tissue in my clinics. I talk about this all the time. Scar tissue is like glue that gets inside the muscle, makes it very hard for the muscle to stretch and contract how it's supposed to, leads to decreased flexibility, pain, and weakness. Now, most people say, well, how the hell did I get scar tissue? I didn't get an actual injury there. And I always say, great question. Actually, from sustained postures, overuse, muscles don't get enough blood flow, don't get enough oxygen. It actually starts what's called the hypoxic feedback loop, sends a message to the brain. Brain comes back and says, hey, there must be an injury there. So it starts laying down more scar tissue to prevent the area. So I see this a lot in the muscles. Also, we'll see it in the ligaments as well. I see it a lot, especially in the ligaments of the spine, as we're sitting too much, looking down at our devices, not moving enough. The ligaments constantly get stretched. When they constantly get stretched, they don't get enough blood flow, enough oxygen, body starts laying down scar tissue. We'll also see it in the muscles and the fascia as well. And another area where I find a tissue problem is going to be in what's called nerve entrapments. There are 256 different places in the body where a nerve entrapment can occur. What does a nerve entrapment present with? Numbness, aching, burning, and tension. Nerves need to make their way through muscles to get where they need to go. And as scar tissue builds up, nerves have about 15% of extra slack to keep them healthy. They get used up, and it's like someone's pinching on that nerve and they might feel it somewhere else. So with manual therapy, we can treat scar tissue. We can treat ligament scar tissue. We can treat muscle, fascia scar tissue, and we can even free up those nerve entrapments. So whenever you have an injury or a problem in there, the first step in any injury, first step across the board is to restore range of motion and figuring out exactly what muscles, ligaments, nerves, and fascia are blocking that. Because if we try to strengthen that, or we try to get the muscles to fire again, we're actually not doing it. It's kind of like building a house. We want to put the foundation down first, and that's where the manual therapy comes in with hands-on treatment. So tissue is our bread and butter. And luckily, like I said, it's the most fixable problem in the human body and the most common. So lots of people have it, and a lot of people aren't fixing it, which is good for you and good for business if you are an awesome, kick-ass manual therapist. Structure. So structure. What are the structures? So while we don't directly treat structural issues, we must know they are present so we can manage the load correctly and keep the client properly informed on their injuries. You know, a lot of times when people have had underlying scar tissue for a long time, they beat the hell out of their bodies, they're gonna have a lot of issues in the bone, cartilage, disc, and the tendon. So one question I always like to ask, like I said before, is there trauma or is there not trauma? When there's no trauma and there's a structural problem, we definitely have a load problem where load is more than capacity and that injury is happening. You're going to see this in the bone when the muscles are having to overwork to make its way through the scar tissue. It puts more pressure on the bone, puts more pressure on the cartilage, puts more pressure on the disc, and puts more pressure on the tendon. So what happens is these structures get beat up because the underlying problem of the scar tissue starts. So think of the scar tissue aspect as like the plaque that forms on your teeth, and then the cavity is the bone, cartilage, disc, and tendon. So I always give this example to people that I coach and train and my clients as well. Think of like your degeneration, maybe in your bone, cartilage, disc, or tendon is like your thumb and it's stuck inside a car door. The car door is all that scar tissue. We can't give your degeneration a chance to heal up until we remove that degenerate, until we remove that scar tissue. So what happens is a lot of people end up getting an MRI, they go to a doctor and they have a bone problem, a cartilage problem, a disc problem, or a tendon problem. They're like, yeah, we'll do surgery on it. And once again, that structural problem is happening because something else isn't working. It is the effect, not the cause. So people will get these surgeries and it's kind of like they pulled their thumb out of the door really quick, but then right afterwards it slammed right back down in there. So they continue to get more and more surgeries because people aren't getting to the root cause of what's going on. It's messing people up, and people have multiple surgeries not getting any better because they're treating the effect, not the cause. And then knowing they have these structure problems, you have to do load management with your client. So when I look at an injury, there's two things that we're looking at. On one side is load, which they do is everything they do, and capacity is what they can take. So when we treat their scar tissue, we treat the muscles, the ligaments, the nerve entrapments, what we're doing is increasing their capacity. So we need them to do less load. So if we're treating them and increasing their capacity, but they're doing more load, it's never going to get any better. I always use the analogy. It's kind of like if we treat somebody for diabetes and they do really well in the office, but then they go out and eat a bunch of sugar, it's not going to get any better. So yes, we don't directly treat a bone, cartilage, or disc problem, but we unload it with our treatments. And it's very important. Even if this person has to have surgery or had surgery, they need their scar tissue cleaned up before and after. Metabolic issues. We are very unhealthy population, and we know that. And I put in here, in some situation, it is literally the giant elephant in the room that wasn't meant to be mean, but people are unhealthy, they're fat, they don't take care of themselves. And that's not being mean, that's just being honest. My own health story. I used to be about 100 pounds heavier than where I was. I had a lot of problems. I had depression, anxiety, joint pain, just not taking care of myself. And finally, someone was just honest with me, one of my mentors, and he goes, you know, Matt, you're very unhealthy. You need to take better care of yourself so you can continue to do this work and continue to be better. And people aren't going to take you seriously if you're unhealthy. So when you have metabolic issues, you smoke, you drink, you don't exercise, you eat like shit, you're dehydrated, you're going to have a lot more inflammation in there. And inflammation is going to continue to build up because not only do you have the scar tissue and the structural problem, but now you got the inflammation on top of that. It's like pouring gasoline on a fire that's already there. So a lot of people skate around this idea and they don't want to like be direct with the client of like, hey, you're 50, 60 pounds overweight. That's bad for your joints. You know, they know they're heavy. They know they're not in optimal health. So it's like just being aware of it, but, you know, not coming right out and being like, hey, you're a fat shit. Just being like, hey, you know, with your extra weight and extra wear and tear in your joints, there's going to be some issues in here. And then understanding that if they are metabolic issues, if they're older, if they have diabetes, if they smoke, if they drink, if they don't eat right, they don't take care of themselves, they're going to need more treatment. That's just honest. They're going to need more treatment and the healing process is going to be a lot lower. So if someone has a lot of metabolic issues, I'm probably looking at least 25 to 50% more treatment and 25 to 50% less healing time. So it's going to take longer. And don't be one of those jackasses. And I've seen this out there a lot that says it doesn't matter that you're overweight. There was someone I saw, I don't remember where it was, on Instagram. They're like, if you're overweight and the doctor or the practitioner says it plays a role in your back pain, they're assholes. No, it's not. That's bullshit. And they're not doing you any favors or helping you at all. It is part of the process. There is an issue in there. Now, it isn't the full process, but it is something that you must consider and not ignore. I always say, be the practitioner that tells them what they need to hear instead of what they want to hear. You know, so many people just are like, they skate around this idea. It's like, just be honest, be like, hey, with your current health, you know, I can help you, but it's going to take longer. And then showing them some things they can do in between to help along the process. But if you're only looking in that very narrow lens of like, oh, it's just a tissue problem, and you're like, you're ignoring that this person is 100 pounds overweight and the effect that it has on their muscles and joints and tendons, like, you're being a jackass. And it's okay. You're not going to offend people. Like, I continue to have people that told me I was fine and it didn't matter. I was big boned or I played football. So it was okay to be better, but it wasn't. I was fucking miserable. I wasn't healthy. And when someone was finally honest with me and told me what I needed to do, it really helped free me. So metabolic is definitely something that you don't want to miss. You want to address, you know, do it nicely. But be honest with the client about what's going on. And don't apologize when they need more treatment. Like, say you think it's only going to take 10 to 12 visits normally, but if they got all this metabolic stuff, tell them you're going to need 16 to 20. And that's just being honest. People would rather have you be honest than blow smoke up their ass. Last one, psychosocial. Understanding the emotional component of the injury and how mental illness can present itself. I've learned a lot about these over the years. When someone is just going through a lot, or they might just be batshit crazy, and that's okay. They say 5% of the population has some severe type of mental illness, and just recognizing it. So how do I recognize it? So one of the things that I do in my 12 questions, and go back and check out that webinar, is I ask them a question. I say, okay, so-and-so, on a scale of 0 to 10, 0, no pain, 10, you wouldn't care if I cut that area off. Like, what is that pain at right now? And they might sit there and tell you it's a 10. And in your mind, you're like, you don't really look like you're a 10. That can really give me some of those red flags that we talk about. Normally for a musculoskeletal injury, I want to see somewhere like a 3 to 7, maybe like 8 or 9. But if they're sitting there talking to me and they're like, I'm a 10 out of 10, I'm like, seriously, you want me to cut? You would rather have me cut off your shoulder? You're probably dealing with a major psychological component. Another one is just addiction to exercise. Exercise is the accepted addiction in society. They're like, oh, well, I must be doing good because I'm exercising. But people take this to so many extremes. You'll hear clients say, if you tell them they need to cut back their load and let things heal, they'll be like, oh my God, I'm going to lose my shit if I don't do this. I'm going to go crazy and whatever. And they're using exercise as their outlet. There's a lot of mental illness involved in that, and recognizing that early, like if they don't cut back, they're not going to get any better, and it's just going to be a problem throughout that. So you have to address it early on. And then the last one is just ups and downs throughout the treatment process. You ever had those clients where they come in and you treat them for the first time, they come back, they're like, oh my God, all my pain is gone. I can't believe what you did. This is amazing. I'm going to tell all my friends and family about you. You're the most amazing person in the entire world. I'm good to go. Then the next visit, they come back, oh my God, all my pain's back and I'm depressed and I'm angry. It's just those ups and downs as you go through that process. I always want to be nice and easy as we go. What I teach in my treatment and my system is we should see about a 5 to 7% increase as we go, and really reality matching the person throughout that process. And here's something that I've learned a lot over the years. People buy off emotion in the front end and then they justify with logic. So yeah, it is important to emotionally connect with that client on that first visit. A question that I always ask, and I always say it's my most important question, is how is this problem affecting your quality of life, and really dialing in. But then once you show them what's going on, you show them with logic and continuing to show them that they're making better improvements with functional improvements with objective data, instead of just like, hey, how do you feel? And honestly, recognizing these people early in the process will save you a ton of stress and frustration. Remember what I said, you can't, if you're for everybody, you're for nobody. And this can really get at people a lot because they want to help more and more people, but sometimes you just can't help people that are psychologically having a lot of issues in there, and it will just end up being a nightmare towards the back end. You're not a mental health practitioner. Your job is to recognize structural issues, metabolic issues, and tissue issues and fix that. You're not there to be that client's therapist and have them unload on you, because it just takes all your energy and you're never going to really get to where you want to be. So let's tie it all together. So number one is just get on this path, like, of thinking critically and becoming a problem solver. The world needs more problem solvers. Quit being like, oh, I'm this type of practitioner, I do this. You jump right into treatment, haphazard, not really know what's going on, and you have no idea if you're actually fixing the client or what's going on. Number two, quit searching for that magical one thing, like, oh, I'm going to treat the fascia, or I'm going to treat this one muscle, I'm going to treat the psoas and all the low back pain will go away, or I'm going to treat the subscap and all the shoulder pain will go away. No, it's multifaceted approach for what's going on, and understand that you have to consider all the factors. Number three, understanding the limits of manual therapy. If you have someone with a lot of structural issues that beats the fuck out of their body and beats their body up all the time, that's going to be a problem. If they're a metabolic nightmare, that's going to be a problem. If they're batshit crazy and they won't take any breaks from the activity that's actually causing them a lot of problems and a lot of issues, avoid those things. And number four, be a clinician first, then a technician. Everyone wants to jump into treatment right away. They're like, oh, just get on the table and I intuitively can figure out exactly what's wrong with you. No, slow down. think critically, figure out what the problem is, because like I said, you have to figure out the problem so you can actually fix it. So ask the right questions. And my webinars go through all that. All my free training goes through all that. You can get all that data and you can start thinking critically and be a problem solver. And lastly, focus on objective data more, less on subjective. So many people focus on how they feel instead of how they function. Subjective is very emotional and it can be up and down compared to what they have. Your job is to have test and retest to know they're making progress in their function. I always say if it doesn't move, it must improve. And as things start moving and start functioning better, they will start feeling better. But if you get really dialed into the client's pain, what's going on, the ups and downs, there could be so many other factors in there that you don't really control. What you control is identifying what's restricting that range of motion, fixing it to the best that you can, educating the client properly about what to do in between visits to make sure that this gets better. So that's all I got. I appreciate you guys watching the webinar. If you like it, give it a comment, a like, a share. Share it with other people. If you haven't got our free training, go get our free training. We go through all of this, asking the right questions, starting to think critically, demonstrating results-driven treatment, and really helping you on the path to go from being a service provider to a solutions provider. I appreciate you guys watching, and I'll see you on the next one. Bye.